Most organs for transplants come from deceased donors. Here's how that happens. A person comes to the hospital with a life-threatening brain injury, such as from an accident, a stroke, or lack of oxygen. The doctors work hard to save the patient's life, but sometimes nothing can be done. There's a complete, irreversible loss of brain function. The patient is clinically and legally dead. That's when being a donor can turn a time of loss into a time of hope. Because machines have kept blood containing oxygen flowing to the organs, they can be passed along. One person can give life to as many as 8 people through organ donation and enhance the lives of 50 people or more through eye and tissue donation. But now, minutes matter. Matches must be found, and transplants must happen quickly. The hospital contacts an organ procurement organization, an OPO. OPOs manage the organ recovery process. The OPO checks the state organ donor registry. If the person is already registered as a donor, they'll inform the family. If not, they'll ask the family to authorize donation. A medical examination takes place. They check the medical and social history, and if the person is eligible to be an organ donor, the computer begins the search on the national waiting list for well-matched patients. The best matched patients for each organ are contacted by their transplant teams. This is the call that every single person on the waiting list has been hoping for. The call that could mean a second chance at life. Now the transplant happens. A surgical team recovers the organs, then corneas and other tissues. The organs are sent to the transplant hospitals where the patients and transplant teams are waiting, and the life-saving transplants take place. It will take healthy living and medications to keep the organ working well in its new home. But some wonderful person has given the most precious gift of all, the gift of life. You too can make the decision today to sign up on your state registry as an organ, eye, and tissue donor. Any age is the right age, young or old. And any day is the right day to sign up as a donor.